day, my name is Jean-Luc James, and today I will be discussing 5 different types of medication: oxygen, oral glucose, nitroglycerin, aspirin, as well as epinephrine. I will also be elaborating on their indications, contraindications, side effects, route of administration, as well as dosage. Now, before administering any medication to any patient, you want to ensure that you maintain their 5 rights. These 5 rights are right patient, right medication, right route, right dosage, right time, and right documentation. Now, depending on your protocol, you may have offline medical direction where if you see the use to administer these medications, you can just go right ahead and administer the medications. But in some special cases, offline medical direction is advised, and you will be preceded by your medical director as to how you would administer these medications. Now, the first medication that I'll be talking about is epinephrine. Now, this medication is administered to patients who are having a severe allergic reaction or anaphylactic shock. Now, the contraindications is hypertension, hypothermia. The side effects can include hypertension, tachycardia, restlessness, as well as anxiety. Now, how you would administer this medication is IM, that is into the muscle, via auto-injector at 0.3 milligrams, or for pediatric patients, 0.15 milligrams. Now, for oxygen, this medication is indicated in patients who are suffering from hypoxia or poor perfusion. Now, the contraindications is that you should not use this gas in or around open flames, and you should also take special precautions with patients who have COPD. Now, the side effect can include dry oxygen can dry out mucous membrane, which is why a humidifier is attached to oxygen before you administer this oxygen to the patient. Now, how you would administer this oxygen is either by inhalation or ventilation. And you can administer from 1 to 15 liters per minute. Now, the next medication that I'll be talking about is aspirin. Aspirin is administered to patients who are having chest pain that is cardiac in nature. Aspirin can also help to relieve other forms of pain, such as headache. Now, the contraindication is that you should not administer this medication if the patient is allergic to aspirin or suffered from any severe bleeding recently. Now, side effects can include bleeding as well as an allergic reaction to aspirin. Now, this drug or medication can be administered orally in the form of 160 or 125 milligram chewable tablets. The next medication is oral glucose. This is indicated in patients who are hypoglycemic. Contraindication is that you should never administer this drug or medication to patients who have a decreased level of consciousness. Now, side effects can include nausea and vomiting. How you would administer this medication is orally at 15 to 20 milligrams. The next medication I'll be talking about is nitroglycerin. Now, this drug is administered in patients who have a chest pain that is cardiac in nature. Now, the contraindication is that you would not want to administer this medication if the patient has taken any erectile dysfunction drug recently, or if they have a systolic BP below 90, or if they have exceeded the maximum dosage. Now, side effects can include hypotension as well as severe headache. How you would administer this medication is sublingually, that is under the tongue, and that is at 0.4 milligrams. And you can give this patient up to 3 doses at 5-minute intervals or until you have achieved the desired effect. That is my presentation on the 5 different drugs and how you would administer them, side effects, indications, as well as contraindications. Thank you.